Hello everyone, today I'll be demonstrating to you how to do a physical assessment. So first off, you have to set up your location that is conducive for your patient to do uh, physical assessment, and you have to provide privacy for them to be comfortable. Next off is you have to do hand hygiene prior to do the physical assessment. And right now I'll be introducing myself to my patient. Hi, my name is Dave. I'll be your nurse for today and we will do your physical assessment. So, may I know your name?
I'm Paul Misha Jimena. I am 32 years old. I was born October 10, 1990. We're going to do physical assessment.
So, by that time, you will see that the patient is alert and oriented times 4 to his name, the date of birth, uh, his age, and what's gonna happen for today. So, Mr. Jimena, how would you like me to call you? Just Paul or Mr. Jimena?
Paul.
Paul. Okay. Hi, Paul. So, first off, we're just gonna do an inspection of your head. So, right there and then, you have to do a hand washing again, and we'll don gloves. So, unfortunately, I don't have any gloves right now. So, we'll just pretend that I'm donning a glove. So, you have to check the hair if there's any dandruff, any infestation, which I can see, or any alopecia. And make sure that you check also the back of the head if there's some kind of abnormalities like alopecia, especially with the elderly ones and those people who lays in bed more than 8 hours. And then you also check if there's some abnormalities, um, like bruising, um, and also you have to check the symmetry of the face if there's any drooping, which right now it's all normal. And also we'll have to start checking the eyes. So after this, you remove your gloves and do a hand washing and don again a new gloves. So you check also if there's if the eyes are symmetrical, and if there's any discharges, or do you have any pain right now that you're experiencing in your eyes?
No.
No. Okay. Also, you check if there's any redness, and you check also the this conjunctiva, if they're red or not. It's normally pinkish in color. And also you have to check the eyes if they are yellow, which means they are jaundice. So as I can see, my patient here has a normal eyes, and right now we will do we will check the pupils if they are reactive to light. So, Mr. Paul, I'm just gonna flash um, some light in your eyes. So just look at me, and we'll see if there's a constriction of your pupils. So as you can see, the pupils of my patient here constricted +3 when I flush the light. And right now, you will look at my pen light, and you follow whichever direction it will go. So so this time we will go to the direction of the 6 gaze gaze location. So we're gonna go up, the middle, down, back to the middle, up, Okay, so it is all normal. So he was able to follow the direction. So we can just chart now that his eyes is perla, pupils accommodate equal, round, reactive to light and accommodation. Next up, we're gonna inspect the nose. So first off, you have to see um, the if there's any discharges. Do you have shortness of breath?
No.
No. And do you have any discharges that you're having?
No.
No. Okay. So make sure that the nasal membrane is pinkish in color. All good. And right now, are you able? We're just gonna occlude the nose, and then are you take a deep breath? Okay. Are you having difficulty?
No.
No. How about the other side? We'll try. Okay. All good. And now we're gonna check also if prior to that one, prior to occluding the nose, you also have to check the symmetry of the nose. If also there are obstructions while we are checking it. Now we will proceed with the ears. So we have to check here if there are any lumps, which I can see nothing. And if there are like calcification, which we also call the staphy. And now we will check the tympanic membrane. So you raise the ears up and then to the back, and it's all good. No obstruction. And also you do it on the other side as well. All good. So after that, you remove your gloves and then you do a hand washing, and you also do the you don another gloves and will inspect the mouth of the patient. So by doing it, so we'll ask Paul here to ask if he has any pain that he's experiencing right now inside your mouth.
No.
No. Any lesions?
No.
No. Okay. So what we will do is stick your tongue if you're able to do that one for me. Okay. Move it side to side. Okay. So I think that's all good. And then we'll check if there are any lesions, if there are cavities, which I can see nothing. We also have to, while checking to make it clearer, we also need to use a tongue depressor by this time. Your mouth, please. So right now we will check his gag reflex if he has an intact gag reflex. Okay, I'm gonna first. Sorry, Paul. We just close your mouth for a sec. So this time I'm just gonna stick this tongue depressor. You will feel uncomfortable with this one. Okay. Okay. Open your mouth, please. And we also have to check if his cranial nerves are intact by this time. So, I'm just gonna clench your teeth, and then are you able to open your mouth? Okay, close it. Okay, and then Just gonna clench your teeth and just gonna touch your tympanic here. Okay. Are you able to open your mouth with resistance? Open your mouth. Okay. Close it. Okay. Good. It's all intact. We'll also check the carotid artery, but make sure you do it one at a time. Good. +2. Okay. All good. So this time we'll do the checking of the neck. So we'll inspect if the neck is okay, and we're just gonna raise your head up a little bit. I'm just gonna palpate the trachea here, if they are intact, if any lesions are here, which I can feel anything. And we'll check, are you able to shrug your shoulder? Okay. Alright. So they're all good. I'm gonna grab my stethoscope here. And if we could, we're just gonna listen to any bruit. So now we will proceed with the checking of the limbs here. You check if there's any bruising, any rashes. There's nothing in there. Are you able to check if there's some screeching sound here? Any pain?
No.
Paul? No. How about this one here?
No.
Okay. Are you able to squeeze my fingers to the best of your ability? Okay. All good? Okay. Are you able to raise your hands? Get down. Okay. So by this time, we will now check the chest of our patient. So before I forget, with the assessment of the nose, we have also to check the olfactory nerve if it's intact. So sorry about this one. I totally forgot about that one. So what for assessing the olfactory nerve, if it's intact, you will let the patient close his eyes, and I'm gonna let you smell something. So, but make sure that it's pleasantly smelling, not the stinky one, because sometimes the patient can have a really bad gag reflex. So, you recognize the smell? Can you tell me?
Vicks Vapor.
Okay, you can open your eyes now. So as you can see, we will start assessing the chest of our patient here. So we make sure that the patient chest is symmetrical, and also there's no bruising, no rashes, and also if he has make sure that it's normal. Not the patient doesn't have any is not a barrel chested. So as you can see, the patient is all good. And Paul, are you able to sit down now? So right now we will be assessing the heart sounds. So there are 5 locations for this one: the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral valve. So first you will listen to the aortic. It's usually in the second intercostal space. Using your diaphragm here. This is the herbs point. It's the in the third intercostal space. This is the tricuspid. And then we're going to the mid clavicular line here. This is where the mitral valve. All good. Well done. And you can also, while doing this, you check if there are abnormal heart sounds as well. And now we will check the radial pulse of your patient. Do you have any chest pain that you're experiencing?
No.
No. And any other discomfort?
No.
No. Okay. So now we will proceed to do the listening to the lung sounds. So as you can see, the left has 2 lobes and the right has 3 lobes. Oh, sorry, the other way around. The left has 3 lobes and the right has 2 lobes. Can you take a deep breath for me, sir? Clear. And then we'll check in the mid axillary line. Yes. Side. Okay. So now we will be checking the back. So first off, you inspect if there are bruising and any rashes that you need to report. Do you have any back pain, Paul?
No.
So make sure when you're listening to the lung sounds to locate the scapula. Don't listen to that part. You just have to listen in between the spine and the scapula. Okay, take a deep breath for me. And then now we'll be checking the so now we will be proceeding to doing the assessment of your abdomen here. So we'll start at the right lower quadrant, and we're gonna assess all the way up to like a clockwise. But first off, you have to assess if there's any abnormality like bruising, rashes, and Do you have um, any pain, abdominal pain, Paul?
No.
No. And when was the last time you had a bowel movement?
Last night.
And do you have any difficulty urinating?
No.
Okay. So by using your bell, uh, you will listen to the abdominal sounds. Okay. So as you can observe, we uh, we started with the same thing. We inspected the abdomen, but this time we had to do the auscultation first instead of doing the palpation. Um, it's because if you do the other way around, you might be disrupting the abdominal sounds. So right now, you grab up new pair. You do a hand washing again, and you grab a pair of gloves. So Paul, I'm just gonna palpate your abdomen here. Any pain here?
No.
Not here.
No. No.
No.
No.
Okay. How about here?
No. 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 No.
Okay. So as you can see, the patient said he doesn't feel any pain, and I can't feel any mass while I was doing the palpation. So next up, we'll do assess the legs of the patient. So when you are assessing the legs of the patient, we'll start with the inspection as well, and if there's any bruising and any discoloration. And now we will feel the popliteal pulse, which is behind the knees here. It's intact. And I'll check for edema in the tibial part here. Good. And also we'll observe if there's if with the size of the leg, if it's symmetrical or not. So, and then now we will check the pulse here. Good. All intact. And now we will check with the Babinski reflex. So if once I'll touch the bottom of the feet here, you will see a reaction of like folding of the toes here, which is all normal. Okay, Paul, I'm just gonna do the Babinski reflex to check. So now we'll also check in between the toes. And we'll do the capillary here, reflex. Going back. All good. And I guess that's it for the physical assessment. And by the way, we have to make sure also the heels uh, are all good without any lesions as well. So I guess that's it for my presentation for the modified head to toe assessment. I would like to thank you for giving me the opportunity to demonstrate to you what I learned in our health assessment course. Thank you so much and have a great day.